So we developed this pocket guide. We call it the 3Ds, and I think most people, when they talk about it, it's the 3Ds of depression, dementia, and delirium in any order. And we developed it to help the clinician, the person in the nursing home, the physician, the nurse practitioner, the physician assistant, and even the nurse on the unit, when a problem arises or when a person has one or more of these conditions, can you tease it apart, or can you come up with a diagnosis as to what the person has? Because oftentimes these conditions can be confusing.
So the 3Ds were developed to put dementia, depression, and delirium together in one guide because these conditions often overlap in post-acute long-term care medicine. It's important for the clinicians to understand and be able to differentiate between these three conditions. We think it's very helpful to have the 3-in-1 pocket guide.
I think the pocket guide is going to be very helpful because it is a quick reference to sorting out the differences and the similarities of the three conditions. Surprisingly, one person can have 1, 2, or 3 of these conditions simultaneous, and the pocket guide can, in a relatively quick way, let the practitioner determine what might be the major cause that they're seeing the patient that day. For example, they may have some cognitive impairment or dementia, and they may have had that for a while. But something changed today. So are they delirious? And how can you separate out the delirium from the dementia and then come up with a treatment plan for that person?
So one of the most interesting part is that, particularly for dementia, there's not a lot of evidence out there specific for post-acute and long-term care medicine. As we were looking through the clinical trials, many of our nursing home residents have been excluded, which offers us a tremendous opportunity as the society leading for post-acute and long-term care medicine to provide guidance to the rest of the providers out there